I'm Dr. Rachel Ferrari, and I'm an outpatient psychiatrist at the Cleveland Clinic. An intellectual disability, according to the DSM-5, is a condition that starts during the developmental period, so when an individual is less than 18 years old, and it includes deficits in both intellectual functioning and adaptive functioning. And adaptive functioning includes different domains. A social domain includes the way an individual is able to communicate and interact with other people. The conceptual domain, you think of more like academic skills, so your reading, writing skills, all of those skills that you learn throughout your school years. The practical domain includes different life skills, so domestic skills like cleaning your house, preparing meals, and self-hygiene skills. Generally, overall, the symptoms appear during childhood, so when an individual is less than 18 years old, and as they're trying to meet those developmental milestones as assessed by their pediatrician. So are they walking on time, speaking on time, drawing on time, counting on time? And then also, at school, teachers may identify an individual who is not interacting with their peers in the same way or is having some academic difficulties. Rarely individuals who have an intellectual disability can be missed during childhood, unfortunately. They get through life, they're an adult, but maybe they're struggling in some ways because they don't have the support system they need. If that is the case for you, it's best to start with your family doctor, let them know about your concerns, and then they can either refer you to a psychiatrist or a psychologist for further assessment to make sure that you weren't missed as a child. So there are different levels of intellectual disability, including a mild level, moderate, severe, and profound. Every person is a unique individual, and these are averages of what individuals are like in these categories, but it may not describe everyone perfectly. For a mild intellectual disability, that's actually the most common level of intellectual disability. It includes about 85% of those who are intellectually disabled. They're able to fully communicate, speak in full sentences. They often have a wide range of friends. They're capable of independent living, and oftentimes they are individuals who are working using simple skills. They may need some support, though, in making decisions about their healthcare, nutrition, shopping, or raising a family. But overall, very functioning in many areas. Whereas the moderate level of intellectual disability, this includes about 10% of those with intellectual disability, they will need help with tasks such as money management. And socially, they can still completely verbalize, but they may use more simple spoken language. Their social judgment is somewhat impaired, so they'll need support making life decisions and how to socially interact. They are often able to achieve independent self-care with some moderate support, and they are able to live kind of independently, but in a more supported setting, so such as a group home environment. When you look at the more severe levels of intellectual disability, so the severe level and the profound level, these individuals tend to need higher levels of support. So with the severe level of intellectual disability, this is about 5%. They can often use basic words, phrases, or gestures to communicate. And in the practical domain, looking at their life skills, they are trainable in some of the basic activities of daily living, but generally need significant support. And then those with profound intellectual disability, which is about 1% of those who are intellectually disabled, they need substantial support. They generally are better at physically interacting with their environment rather than on an abstract level. and they tend to express themselves non-verbally using gestures, emotional cues, and they are dependent upon caregivers for their activities of daily living. With intellectual disabilities, they are considered chronic lifelong illnesses. So it's not something that you tend to grow out of over time. So the focus is on their quality of life, their strengths, their goals, and we take a very person-centered approach. And we look at, what is the idea of the good life for them? What does that include? Do they want to work? Do they want to try to live independently? What supports will they need in their life to achieve that? And when you look at all those pieces of the puzzle, the individual doesn't grow out of the intellectual disability, but they still live a very happy and fulfilling life.